Hello everyone. I'm doing DNB radiology and I'm in third year right now. And बहुत debate होती है MD versus DNB, MS versus DNB. So I'll try to answer many of the questions I have got in my mail and Instagram, and we'll try to look for it. Okay. So what actually is DNB? It is Diplomate of National Board, not Diploma of National Board. It is Diplomate of National Board, and this degree is given by NBE, National Board of Examination. So while MCI gives MD and MS degree, DNB degree is given by National Board of Examination. So DNB is of two types, like primary DNB and secondary DNB. Like in primary DNB, the candidates are the students who have given the MBBS examination only. The post MBBS candidates are primary DNB candidates, while post diploma candidates, so they are the secondary DNB candidates. So the post diploma candidates who have already done 2 years of diploma course earlier, now they will apply for secondary DNB. While the primary DNB course is of 3 years, secondary DNB course is of 2 years. Okay, because earlier after diploma course you cannot apply for a professor consultant job in a government hospital, government college. But after doing secondary DNB, after doing diploma, then after doing diploma you are doing secondary DNB, you can apply for post of assistant professor or consultant in a government college. So these were the two kind of DNB degrees which are there. So first question was, since many of the private hospitals are giving these DNB degrees, is there any like is the fees is also kind of different? But the whole, in every part of India, there is fixed fees, whether you are doing primary or secondary DNB, or whether you are in first or second year, the fees is same. Whether you are doing in a government hospital or whether you are in private hospital, the fees is same. Last year it was 1.47 lakh. This time it is approximately 1.25 lakhs per year. You are also getting the stipend. Most of the DNB hospitals are giving approximately 50 to 60,000 stipend. Few of them are giving a lesser, like 30 to 40,000, and few are giving also 60 to 70 to 80,000, like in Delhi. So they have fixed fees, they are giving stipend. So one other difference between MD, MS and DNB is the examination pattern, because in MD and MS the examination, the main examination are taken in your campus, in your college only, while in DNB it is taken at a further center. So both the theory and the practicals. So you have to, in DNB there is no the external won't be influenced by your internal. Like if you have done a lot of work in your hospital, then it won't be like that you have done a lot of work, then it will be like you will pass in examination. You have to pass on your own. That's a different difficult thing about DNB. But it's not like that if you have not if you have studied but you will not pass, because the paper pattern in the practicals is better in DNB. It's a OSCE based pattern, and in OSCE based pattern you are just objectively, not subjectively. It's not only small portion will be used as viva, because by the external, but mostly you will be assessed by OSCEs. So OSCEs are either you're wrong or you're right. It won't be like you won't be, the marks won't be dependent on the external, but you have to give the practical examination and the theory examination at a different center. The theory examination centers are like the centers we get in NEET or INICET examination, where we have a computer screen. So here you have you'll get a copy, and the good thing is you will get the copy will be marked with question numbers. Like each question number, if there are 10 questions for 100 marks, and each question number will get 5 pages. So you can't after 5 pages there will be written question number 2. So you cannot write more than 5 pages for a question. So it won't be like our MBBS questions, or like we will write some for 10 pages a question, and we can't write for a question more than 1 page. So the maximum you can write is for a question will be 10 for 5 pages. Okay, so these are the things that are better in DNB, because DNB are conducting the examination much better way. But if you have to pass by studying only, you cannot pass without studying. But if you are studying, then you will definitely pass. Also, in since these examinations are taking place at a different center, they're taking place at a different hospital, so you're not afraid of your consultants that much, because in a government, we all know that in a government college, you actually have to listen to your consultant every time, even they are wrong. You have to suffer a lot, because you know that in the end they have the power to pass you or fail you in the practicals. But in DNB, it won't be like this, because your internal examiners or your HOD or your guide won't be responsible for your final marks, because these are the external who don't even know your HOD, who won't be knowing your HOD, but they won't know that you are their candidate. So it's like your, even if you're having some conflicts with your consultants, that even it won't make you fail in your examination, which does not happen in a medical college. One of the advantages that you get after passing DNB examination is that you are more theoretically and practically stronger examination wise. So if you're giving pre-super specialization examination, then it will be better for you to pass in those examinations, because you have read properly. It won't be like it will be like if you have given the MDMS examination, you would be a little more casual in giving those examination. So but for DNB you have to study sincerely. So you're actually it will be much more easier for you to give those DM examination. Okay, say that academics, like a lot of people will ask, what about academics? What about academics? The thing is, one practical point. Whenever all the classes when are there taking place in post graduation, when you have case discussions in lectures and all, people will be dodging off. Like they will be, because it's too much workload in PG, that you won't be like willing to attend those classes. But still we will look for, we'll say that we want classes and all. So most of the DNB institutes, they don't offer regular classes. Many of them are having case discussions, but these are not regular. Like you won't be like in my hospital also, we don't have regular these things. Once or twice or thrice a week you can have it. So but DNB, the National Board of Examination, had made sure that studies are not affected by these. So they have started, not started, they are actually doing it since a long time, webinars. So twice or thrice a week we are getting webinars. It's approximately 1 hour webinar, where they are discussing many theoretical points and they are discussing many practical points. So it's like you have to log in with your own email ID, and then attendance will be sent to NB. Like after attending, you get a mail that you have attended this webinar. So most of the many theoretical aspects, many practical aspects, they are covered in those webinars, and these webinars are taken by the most of the famous faculties of India, from AIIMS to PGI. They are to the Delhi MAMC colleges. So they are the best faculties and doing their business. So it's not about like you cannot learn in DNB college hospitals, because if they also NB make sure that these attendance are being taken, because after 4 or 5 months there will be like one feedback form to your guide, thesis guide, and to you also, that are you attending these webinars regularly or not. So if you're not attending these webinars, the mail will go to your thesis guide that your ward is not, your student is not attending the webinars. Kindly make sure that he attends those. So these are the things that NB makes sure that. Also you can mail them the topics that you think that in your hospital breast imaging is not proper. So you can mail them. They will make sure that in the next few lectures breast images is being taken. If your musculoskeletal part is weak, if you mail them, they will make sure that in the few days MSK part is being taken. So these are the things that NB does to make the academics good. Also we have FAT papers. FAT examinations is a kind of internal, and it's a kind of we have 3 FAT papers, and 2 are internals and 1 is external. So the external one, which happens in second year, which I also gave, it is a similar kind of paper we get in final examination. So we have to go to a different center to give the theory examination. We have to go to a different center to give the practical examination. So it can make you worse with the what kind of situation you will get to deal with. I was in the second year when 6 months back I gave this examination. So I got to know the things that how my practicals will be taken in the coming time. The other question is, what about surgical branches? So since most of these hospitals are corporate hospitals, so there will be lesser hands-on to be given to the surgical branches. Okay, because the patient will be paying a lot to the hospital and the consultant won't take a risk. So the hands-on in surgery will be an issue, and you have to talk to the seniors who are working there, that how much hands-on do we get there. Also, but there are many trust-based hospitals and railway hospitals in India which are actually government hospitals only, and which are actually government hospital or trust-based hospitals which are giving DNB degrees, and they actually work like government colleges only. Like in our hospital, which is a steel plant, Bhilai steel plant hospital. So here the general surgery guys, they get a lot of hands-on. So you have to, before, it's not like you're getting surgery and you won't get any hands-on. You have to talk to the seniors there, because they might be getting a lot of hands-on. Also, you in the corporate hospital, if you're not even getting the hands-on, you're just getting the degree. Like, I agree that it won't be a good, but if don't have any option, the plus one will be you will be seeing the very good surgeries. You will be seeing the best of the surgeons working there. So that is the plus point of if you're doing in a corporate hospital, the surgery part. So what about the medicine branches and the non-surgical branches? If you're talking about radiology, then it might be even better than many of the MD colleges, because in radiology, what do you need? Better equipments. Okay, so in most of the private or corporate hospitals, you got all the machines, you got the latest machines, you got all the imaging modalities. So it will be better. You won't need a patient every time. You can see the scans later. You can learn from the scans. You don't need the first hands-on the machines. So on radiology part, it is even better than many of the MD colleges. So what are the disadvantages of taking DNB? Like for some people, it might be a name for namesake, because some of the older consultants, they might still think that DNB is still inferior to MDMS, and some of the people, even the non-medicos, might also think the same. But these people are very few in number. Okay, the second disadvantage might be hands-on in surgery. Okay, the third is it would be a little more difficult to pass, because the examination is taken away at a different center. But I have to tell you, the obs gynae passing percentage is approximately 80 to 90%. So that is even much more than the MBBS passing percentage of many colleges. So it's not like that passing DNB is very difficult. Also, the passing rate which you get is combined from primary and secondary. So the post diploma candidate and the post MBBS candidate both give the examination together, and the passing both give the examination together. They have the same paper, and the passing rate is calculated by combining the both the two. So most of the primary candidate which are post MBBS, they actually pass in the first attempt. Okay, so it's not like that they are having a lesser passing percentage. Just I have to tell you about one department, orthopedics, which I don't know what is wrong with that department, because that's the only department I have seen that is having a poor passing percentage. Even I've seen many of the good candidates failing in orthopedics. But apart from that, I have seen all the major departments, they're just doing fine. They're just passing properly. Okay, so the next disadvantage might be that you might not get the feeling of the SRs or the people getting consultant teaching you, or the spoon feeding won't be like that, because if you're working in a college, you might have to take classes of the juniors, you might have to take classes of the MBBS students, and there will be SRs to teach you, there will be lot of people to teach you also. But these kind of things don't happen in most of the DNB colleges. There will be less academic classes, so lesser teaching will be there from the in-hospital things. Okay, the other disadvantage may be that since in most of the hospitals each and every department get 1 or 2 seats, so it will be a much more workload as compared to MDMS seats. Okay, like the work in the MDMS there will be 3, 4 or even much more residents in a single government college, but in a most of the DNB colleges or DNB hospitals there will be 1 or 2 seats, so you have to do much more work. Your emergency duties will be much more frequent. Okay, and you might be even like since you are working in a corporate hospital, you might be even used to do a lot of different department works that can happen in many corporate hospitals, because they can use you as a chief resident. Just but this is a little these are the things that happens less, but it's not that it does not take place. Stipend might be lesser than most of the state colleges, but it is good. It is 50 to 60,000. It's not that if you are getting 50 to 60,000, it is enough for you for your expenses and all. But it won't be like a central hospital, central institutes like 1 lakh, and most of the state medical colleges are even giving 60 to 70 to 80,000. But the stipend is a little bit less as compared to the state medical colleges. So for radiology, I will tell you how to choose a college or a hospital for radiology. When I was deciding on the colleges and hospitals, I made a list that I have to talk to the resident there, and I will talk about all these points. Is there all these points available? Then I have to because in every hospital you get everything. Okay, so you have to decide on your own that is this hospital working for me or not. And the thing is, all the online reviews, all the websites of Quora and everything, they are not the first hand reviews. For even I'm saying something about my hospital right now that might not true after 3-4 years. Okay, so the best thing is when you're choosing the hospital, just before that you talk to the resident there. You might get the phone numbers through the different residents. You call the hospital in the emergency department, you get a call transfer to the department, the resident working there, you get his personal number, and talk to him in the details, because he's the one who can give you the first hand and the most accurate reviews about the department. But beware of like extreme reviews. Like if you're getting too good review about a hospital or you're getting too bad review about a hospital, just try to cross check with a different resident, because it's like I have seen, if I want one of my friend to get into my hospital as a junior, and if some other guy or someone is calling me, then I might be giving like it's not good hospital for you, because so yeah, for extreme reviews, if you are getting extreme bad review or extreme poor review or extreme good review, that you have to please cross check that with other resident. So for radiology, I have made points, and I will like first point is exposure. How is the patient exposure there? Is like number of patients. You have to ask about the number of USGs, number of CTs, number of MRs that are going on every day. What's the hands-on? Like for CT and MR, you don't need a hands-on. Even your consultants are reporting them. You can just review their reports and learn by them. But for USG, you need hands-on, because for USG you need hands-on, and you need hands-on on proper machines. Some other DNB institutes might be giving hands-on only on the bedside machines. So these things should not take place, because you cannot learn USG just by seeing. You have to do it. Okay. Third is, are the USGs antenatal scans are taking place or not? Some will be some cancer specialist hospital, so they might not be having the ops department. So are the antenatal cases being taken there also? But even if you don't get the antenatal cases, you can definitely learn them in your SR-ship later on. So is there the next point will be, is a CT MR machine available? Most of the hospitals will be getting the CT and MR machines. So is there any CT and MR machines available? Okay. Also, the number of consultants and specialists there, because that will affect your learning. Uh, Many of the corporate hospitals, they have specialists for MSK imaging. They have neurological imaging specialists. So that they will be reporting in a much better fashion as compared to simple radiologists. So there you will get better learning chances. What's the stipend and number of seats? The number of seats, if you're getting more residents, if 2 or 3 residents are there, then it will be easier for you to like work properly. If you're just a single resident in a hospital, then it might be like you are doing emergency, or just you are working every day in that hospital. You are just, even you have taken the radiology, you're doing an everyday emergency. The thing is about radiology is like people are just like, it's a OPD based branch and you are just chilling. But I will tell that no, radiology people work a lot, and in DNB radiologists who are working in corporate or these trust-based hospital, they have a lot of work to do. Okay, the next thing is the working hour and the emergency duties and the toxic or non-toxic culture in the environment. Also, the hostel is the hospital giving you a hostel accommodation, because in some of the many of the hospitals are giving, some are not giving, even some are not giving the accommodation. You in the NBE, it is like if you're not giving the accommodation to the student is eligible to get approximately 30,000 refund from the fees. So in our hospital, the people who don't opt for the hostel from given by the hospital, they can opt for refund, so they get refund. Okay. Next you can ask about academics and the passing percentage. Though passing percentage depend on the candidate itself, because you have to study on your own, but still the trend, what's the trend going on, how well are your senior passing, it also depends on them. The next thing is intervention. uh, I don't have I don't have interest in intervention radiology, but many other people might get interest in radiology intervention things. So are there intervention happening? Are there vascular or non-vascular intervention going on there? What is the hands-on given on them? Okay, so the next thing is, how are the other departments? Because radiology is not a single department. It's not a single department working, because it works with every other department. How the surgery department? How's the obs-gynae department? Because number of ANC cases you will get to see depends on the ops department working there. The quality of pediatric cases you get to see depends on the pediatric department work of that hospital. The quality of surgical cases you will see, that depends on the surgery department. So if these departments are not that good, that you might not get cases of those departments. Okay, these were the things, and some might be like city or every other thing else, but these are the checkpoints you can make sure. And then every hospital won't be proper, won't be giving you everything, but you have to think that what all hospitals, what are my choices, what do I want. Like there will be one hospital who will giving you enough of USG exposure, you will get everything, but they won't be getting MR, you won't be getting MRI cases, you won't be getting, but there will be one hospital which is giving you CT and MRI and won't be giving you USG cases. So in both of the cases you can learn them later on in your life during your SRship, but that thing will depend on you. How do you want the cases to be? The next thing is about holidays. In the government hospital, the holidays will be given, OPD holidays will be given according to the government holidays, all those gazetted holidays. But in a corporate hospital or a trust-based hospital, which is not which is not a government college, those will be though you won't get those holidays, because those holidays will be decided by the hospital itself. So even in my hospital, which is actually a Bhilai steel plant hospital, which is actually a government hospital, but still the steel plant decides the holidays we get. So there are actually 4 or 5 holidays, only 4 or 5 gazetted holidays we get in the whole year. But not all those. We won't get Christmas holiday, we won't get a Eid holiday. We just get one Diwali, Holi, 26th Jan, 15th August, 2nd October. I think these 5 6 days only we get the holidays. So all other Raksha Bandhan or Janmashtami, Even Christmas, Eid, we don't get holidays for those. So this kind of thing happens in lot of DNB colleges. Okay. So other thing you might disadvantage is that campus. The campus thing you would be enjoying in your MBBS days. The campus won't be there. You are just a hospital. There won't be so much of crowd. The MBBS crowd. There won't be more fests going on. So the campus things, the fest and all, you will miss them. You won't get these things here. Also, in most of the MDMS courses, you get a preparatory leave just before your MDMS examination. You get leave for a month or two for preparing the final examination. This might not happen in most of the DNB colleges. My final message would be like, don't listen to others. Okay, it's not like people will be like pulling your parents to like, don't take DNB, don't take MD and MS. The competition is so much severe, and everyone is not a topper. So it's not like you will get a top MDMS seat. If you're getting just select your branch, and if you're getting, it should not be like you should take MDMS. But if you're dedicated towards your branch, and you should take DNB. Okay, in my preference, what I want to tell you that for surgical branches you should prefer MS, but for MD branches you should inquire. Because many of the MD colleges even would be more worse than the DNB colleges. Okay, so just listen to your heart. Do what you want to do, and just not for the name's sake, for the degree sake. Just do what you want to do, because the branch will stay with you. You can learn the skills later on in your life also. But if you change a branch just because you were getting an MD degree for that branch, then that branch will stay with you forever. You can learn in that branch only. It won't be like if I was getting DNB surgery, but I took MD anesthesia. But you cannot do surgical procedure later on. But if you got DNB surgery, you can learn the surgical process later in your life. So that was it.